Welcome to the Spanish Medical Interpreters online class. We are happy to have you all here. Let's first review the learning objectives for this class. The nervous system keeps us in touch with both our internal and external environments. Serving as the control center and communications network, it stores and processes information, stimulates movement, and detects change. In this chapter, we will learn to recognize and write the functions of the nervous system, recognize and write the meanings of Chapter 13, word parts, and use them to build and analyze terms. Write terms for select structures of the nervous system and match them with their descriptions. And write the names of the diagnostic terms and pathologies related to the nervous system when given their descriptions and match terms with their meanings. We will also learn to match the names of psychologic disorders with their descriptions, match surgical and therapeutic interventions for the nervous system, or write the names of the interventions when given their descriptions, spell terms for the nervous system and psychologic disorders correctly.
This conference will now be recorded.
The nervous system affects both psychologic and physiologic functions. The study of behavior and of the function and processes of the mind is called psychology. Psycho means mind and logi means study of. Therefore, the word psychologic pertains to the mind. Physiologic is pertaining to physiology. Physio means nature, so physiology is the study of the processes and function of the body. The nervous system influences other body systems. For example, damage to the spinal nerves that supply nerve impulses to the diaphragm may result in respiratory arrest. Sensory receptors detect changes that occur inside and outside the body. Some receptors monitor changes such as changes in room temperature, and other receptors monitor changes within the body such as body temperature. Integrative functions create sensations, produce thoughts and memory, and make decisions based on what is received from the sensory receptors. The nervous system responds by sending motor or efferent signals to muscles and glands to cause an effect in them.
Ever wonder why you have to make an effort to add or subtract numbers, but you breathe without having to think about it? The part of the nervous system under conscious or voluntary control is called the somatic nervous system. The part of the nervous system that relates to involuntary or automatic body functions is called the autonomic nervous system. Some functions, such as breathing and digestion, happen automatically, but many nervous system functions are under our control. In this figure about the divisions of the nervous system, shows information about the central nervous system, which includes the brain and spinal cord. In yellow, the peripheral nervous system, in blue, is made up of nerves that take impulses away from and toward the central nervous system, CNS, to receptors, muscles, and glands. The following is a simplified view of the divisions of the nervous system. Two major divisions of the nervous system are the central nervous system, CNS, and the peripheral nervous system, PNS, as shown in this picture.
The nervous system, along with the endocrine system, controls and integrates the many different functions performed by organs, tissues, and cells to maintain homeostasis. The brain and spinal cord make up the central nervous system, or CNS. The CNS integrates incoming sensory information, evaluates the information, and initiates an outgoing response. All the nerves and branches outside of the CNS make up the peripheral nervous system, or PNS. Nerves originating from the brain are cranial nerves. Nerves originating from the spinal cord are called spinal nerves. Nervous tissue in both the CNS and PNS form incoming and outgoing pathways. The afferent division consists of all the incoming sensory or afferent pathways. The efferent division consists of all the outgoing or motor or efferent pathways. Another way the components of the nervous system are organized is based on what they regulate. The somatic nervous system, or SNS, carries sensory or afferent information from the skin, muscles, and bones into the CNS. The SNS also carries motor or efferent information to the somatic effectors, which are the skeletal muscles. The autonomic nervous system, or ANS, carries sensory or afferent information from the organs into the CNS. The ANS also carries motor or efferent information to autonomic or visceral effectors. These are smooth muscle, cardiac muscle, and glands. As its name implies, the autonomic nervous system seems autonomous, which means able to govern itself without conscious control. The efferent pathways of the ANS can be further divided into sympathetic and parasympathetic divisions. The parasympathetic division coordinates the body's normal resting activities, or rest and repair. The sympathetic division prepares the body to deal with immediate threats, producing the fight or flight response.
Let's refresh our minds about the structure of the medical terms before we move forward with this chapter. Remember that prefix goes at the beginning of the medical term. It is descriptive and let us know about the location, quantity, number, color, direction, amount, or size pertaining to the root of the medical term. The root goes in the middle. It represents the subject of the medical term and pertains to a body part or system most of the time. And at the end of the medical term or word part goes the suffix. It provides the meaning of the medical term. In other words, it lets us know if the medical term refers to a disease, test, disorder, condition, specialty, process, procedure, and so forth. Now, let's see some examples of word parts for the nervous system. An autologous graft is a graft of your own tissue. Cerebello means cerebellum. Did you know cats have a relatively large cerebellum? Cerebro and encephalo mean brain. The prefix n means inside and cephalo head. Cervico pertains to neck and sometimes to the uterine cervix. Coccygo means coccyx, also known as tailbone, and a region of spinal nerves. And cranio means cranium or skull. Let's continue reviewing combining forms for the nervous system. Dendro means tree. Think of dendrites as branches to the nerve. Duro means dura mater. In German, means tough mother, in medical terms, the outermost of the three meninges. Glio, as in neuroglia, or a sticky substance like glue. Lumbo pertains to the lower back. Remember the spinal nerves. Meningo means meninges, like a three coverings of the brain. And myelo means bone marrow or spinal cord. Let's review more. Combining forms for the nervous system. Mento and psycho mean mind. Example, psychology, nervo, and neuro stand for nerve. Freno also mean mind or diaphragm. We'll discuss schizophrenia later, but this is a good example for Freno. Physio means nature, like physiology. Sacro pertains to sacrum, which is the portion of the spine that forms part of the pelvis. And spino means spine. Some of these terms are easier than others. But we still have to learn them all to be able to identify the medical term by their prefixes, roots, and suffixes. Let's review the spinal cord and emerging nerves. 31 pairs of nerves emerge from the spinal cord and are named and numbered as cervical, thoracic, lumbar, sacral, and coccygeal nerves. The combining forms for each area of the spine: cervico for the neck, thoraco for the chest, lumbo for the lower back, sacro for the sacrum, and coccygo for the coccyx or tailbone.
Quiz time. The two major divisions of the nervous system are A. Autonomic and peripheral, B. Central and peripheral, C. Autonomic and central, or D. Central and somatic. One volunteer at the time, please.
Let's review some diagnostic terms. Electroencephalography. Electro means electric, encephalo means brain, and graphy, recording. Therefore, electroencephalography is the recording and analysis of the electrical activity of the brain. The record obtained is an electroencephalogram. The diagnosis of brain death may require electroencephalography to demonstrate that electrical activity of the brain is absent. Electromyography, myo means muscle, is the preparation, study, and interpretation of an electromyogram, a graphic record of the contractions of a muscle as a result of electrical stimulation. Myelography, myelo means bone marrow or spinal cord, is the radiographic inspection of the spinal cord by injection of a radiopaque medium.
In a cerebrovascular accident, also known as a CVA, stroke or stroke syndrome, the normal blood supply to the brain has been disrupted. CVA results in insufficient oxygen to brain tissue, caused by hemorrhage, occlusion, or constriction of the blood vessels that normally supply oxygen to the brain. Paralysis, weakness, speech defect, and other complications, as well as death, may occur. Some types of strokes are commonly preceded by warning signs such as a transient ischemic attack, or TIA, caused by a brief interruption in cerebral blood flow. The term ischemic pertains to deficient blood circulation. TIA symptoms often include disturbance of normal vision, dizziness, weakness, and numbness. Disorders such as brain tumors that interfere with the flow of cerebrospinal fluid cause hydrocephalus, fluid accumulation in the skull. The fluid accumulation is usually accompanied by increased intracranial pressure. When this happens in an infant before the cranial bones fuse, the skull enlarges. In an older child or adult, the pressure damages the soft brain tissue.
Akinesia, A, means no, kinesio, movement, and IA, pertaining to. Therefore, akinesia, the complete or partial loss of muscle movement. Bradykinesia, brady means slow, and kinesia, movement. So, bradykinesia is abnormal slowness of movement or sluggishness of mental and physical processes. Hyperkinesia, hyper means excessive, and kinesia, movement. Hyperkinesia is abnormally increased activity or motor function. Anesthesia, an means no, and aesthesio means feeling. So, anesthesia is partial or complete loss of sensation with or without loss of consciousness and resulting from disease, injury, or administration of an anesthetic. Diseases and disorders. Aphagia, A, means no. Phagia means eating. Aphagia is the inability or refusal to swallow. It is characterized by abstention from eating because swallowing is painful. Aphasia, phasia means speech. Therefore, aphasia is the absence or impairment of the ability to communicate through speech, writing, or signs. It results from a brain dysfunction. Dysphagia, dys, means difficult. So, Dysphagia is a speech impairment caused by a lesion in the brain, characterized by lack of coordination and failure to arrange words properly. Cephalalgia. Cephalo means head, and algia, pain. Therefore, cephalalgia means headache. Neuralgia, neuro, nerve. It is pain along the course of a nerve. Cerebral concussion. Cerebro means brain, and al means pertaining to. Therefore, cerebral concussion is the loss of consciousness, either temporary or prolonged. As a result of a blow to the head, cerebral contusion is bruising of the brain tissue as a result of head injury. Cerebral hemorrhage, hemo means blood, and ridge means excessive bleeding. So, cerebral hemorrhage is the result of the rupture of a sclerosed or diseased blood vessel in the brain. Coma is a state of unconsciousness from which the patient cannot be aroused, even by powerful stimulation, which is different from a persistent vegetative state where there is no longer cerebral function.
Let's determine the meanings of the next terms by word part analysis. Diplegia, di means two, and plegia, paralysis. Therefore, diplegia means paralysis affecting like parts on both sides of the body. Hemiplegia, hemi, half, paralysis of one side of the body. Paraplegia, para, near or besides, paralysis of the legs and lower part of the body. Quadriplegia, quadri, four, paralysis of all four extremities. This is also called tetraplegia.
Cerebral palsy is a brain disorder characterized by paralysis and lack of muscle coordination. It results from developmental defects in the brain or trauma at birth. Myasthenia gravis. Myo means muscle and asthenia, weakness. Therefore, myasthenia gravis is a disease characterized by muscle weakness and abnormal fatigue. Epilepsy. Lepsy means seizure. So, epilepsy is a group of neurologic disorders characterized by recurrent episodes of convulsive seizures, sensory disturbance, loss of consciousness, or all of these. An uncontrolled electrical discharge from the nerve cells of the cerebral cortex is common to all types of epilepsy.
You already know the meanings of all of these terms, just by knowing the meanings of the word parts. Meningitis. Meningitis is an inflammation of the protective membranes, covering the brain and spinal cord. Encephalitis. Encephalitis is an inflammation of the brain itself. Encephalomeningitis. Encephalomeningitis is a combination of encephalitis and meningitis. Neuritis. Neuritis is inflammation of the nerves. Myelitis. Myelitis is inflammation of the spinal cord. Encephalomalacia. Encephalomalacia is the softening of brain tissue. Encephalopathy. Encephalopathy is a broad term for any brain disease that alters brain function or structure. Neuropathy. Neuropathy is damage or dysfunction of one or more nerves. Narcolepsy. Narcolepsy is a chronic sleep disorder characterized by overwhelming daytime drowsiness and sudden attacks of sleep. Shingles. Shingles is a viral infection that causes a painful rash. It is also known as herpes zoster and is an acute, infectious eruption of vesicles, usually on the trunk of the body, along a peripheral nerve, causing a lot of pain and discomfort to the patient.
You already know the meaning of these terms by knowing the word parts. Let's discuss the meaning of each word part for craniotomy, craniectomy, cranioplasty, neuroplasty, and neurorrhaphy. Let's start with the last one. I will use this one as an example to show you how I need you to analyze each of the terms on this list. Neurolysis. Lysis means destruction, and neuro means nerve. Although neurolysis has several meanings, such as release of a nerve sheath by cutting it longitudinally, operative breaking up of adhesions surrounding a nerve, relief of tension on a nerve, and disintegration of nerve tissue. Now, we need one volunteer to do the same with the rest of the surgical and therapeutic interventions listed above. One volunteer at the time, please. Pain management may be for a short time, for example, after surgery, or longer, as in chronic pain. What is the purpose of analgesics? They relieve pain without causing loss of consciousness. Nerve blocks temporarily block transmission of nerve impulses. Hypnotics are drugs often used as sedatives to produce a calming effect. What type of agent relieves or prevents convulsions? Anticonvulsants, such as phenytoin or Dilantin, and topiramate or Topamax, just to mention a few.
Quiz time. Myasthenia gravis is A disease characterized by muscle weakness and abnormal fatigue. B. Chronic disease of the central nervous system in which there is progressive destruction of the myelin sheaths of the neurons. C. Chronic ailment involving sudden attacks of sleep that occur at intervals. Or D. Chronic disease of the inner ear. Who knows the answer? Word parts for psychological disorders. Arachno means spider. Claustro means a barrier or closed space. Pseudo means false. Zoo, animal. Agora, marketplace. Asthenia means weakness, while aesthesia means sensation or perception. Lexia means words, phrases, like in dyslexia, the inability to read, spell, and write words despite the ability to see and recognize letters. And orexia means appetite.
Psychologic disorders are unlike most diseases or disorders that confront health professionals because there often is no change in the body structure and sometimes not even detectable changes in the chemistry of the body, making the abnormalities difficult to demonstrate and treat in the usual sense. In the following video, we will learn about the following psychological disorders: psychosis, schizophrenia, neurosis, autism, attention deficit disorder, ADD, attention deficit hyperactivity disorder, ADHD, hyperkinesia, hyperactivity, hyperkinesis. We will also learn about diseases that display observable physical changes in the brain, such as mental retardation, dementia, and Alzheimer's disease. In addition, we will learn about anxiety, post-traumatic stress disorder, PTSD, panic attacks, and obsessive-compulsive disorders, OCD, and dissociation, antisocial behaviors, paranoia, somatoform disorders, hypochondriasis, pseudoplegia, neurasthenia. Also, we will learn about sexual disorders, sexual dysfunctions, sexual perversions or paraphilia, eating disorders, anorexia nervosa, bulimia, and mood disorders, such as clinical depression, manias, megalomania, pyromania, kleptomania, and bipolar disorder. So, let's dive into the wonderful world of the mind.
Psychological disorders are unlike most diseases or disorders that confront health professionals because there often is no change in the body structure, and sometimes not even detectable changes in chemistry, making the abnormalities difficult to demonstrate and treat in the usual sense. Psychosomatic, which means psycho for mind and somato for body, pertains to the mind-body relationship or having body symptoms of emotional origin. The DSM establishes diagnostic codes for record keeping. Of the many classifications of psychiatric disorders, the most serious form, a psychosis, refers to any major mental disorder characterized by a gross impairment in reality testing and often characterized by inappropriate mood and diminished impulse control. Symptoms may include hallucinations, which are false sensory perceptions, delusions, which are false beliefs, and strange behavior. Schizophrenia is characterized by hallucinations, disturbances of language and communication, and disorganized or catatonic behavior. Neurosis is the former name for a category of mental disorders in which symptoms are distressing, reality testing is intact, behavior does not violate gross social norms, and there is no apparent organic cause. Autism is characterized by withdrawal and impaired social interaction and communication. Persons with attention deficit disorder, or ADD, and attention deficit hyperactivity disorder, also known as ADHD, demonstrate short attention span and poor concentration. In ADHD, hyperactivity is also characteristic. Hyperkinesia, hyperactivity, and hyperkinesis all mean above normal amounts of movement. Only a few psychologic disorders have observable pathologic conditions of the brain. Another example of observable pathologic conditions is Alzheimer's disease. The structural changes in the brain are seen when an autopsy is performed, but the disease is characterized by progressive mental deterioration with several characteristics including confusion, memory failure, disorientation, restlessness, and inability to carry out purposeful movement. The symptoms worsen with age. Anxiety is anticipation of impending danger and dread. A permanent state of nervousness, worry, and apprehension can lead to depression. PTSD is an acute emotional response after a traumatic event or situation involving severe environmental stress. A panic attack is an episode of acute anxiety that occurs unpredictably. Obsessive-compulsive disorder, or OCD, is characterized by recurrent and persistent thoughts, ideas, and feelings sufficient to cause distress or interfere with activities of daily living. A compulsion is an irresistible, repetitive impulse to act contrary to one's standards. An obsession is a persistent thought or idea. In dissociation disorders, emotions are so repressed there may be confusion in identity and a split or separation of personality. An antisocial behavior acts against the rights of others or contrary to societal standards. In paranoia, there are persistent delusions of persecution accompanied by distrust and combativeness. Somatoform disorders are characterized by symptoms suggesting physical illness or disease, which cannot be demonstrated. Hypochondriasis includes an unrealistic interpretation of physical symptoms despite evidence to the contrary. Pseudoplegia is a loss of muscle power without actual neurologic paralysis. Neurasthenia is a nervous disorder characterized by weakness and sometimes nervous exhaustion. It is believed by some to be psychosomatic, although it is often associated with a depressed state. Mood disorders are characterized by disturbance of mood as the main feature. Mania is an unstable emotional state that includes excessive excitement, elation, ideas, and psychomotor activities. In megalomania, individuals believe they are a person of great importance, power, fame, or wealth. In pyromania, there is excessive preoccupation or obsession with fire. In kleptomania, there is an uncontrollable urge to steal. Sexual dysfunction is a decrease or disturbance in sexual desire. Paraphilia is sexual deviation or perversion, which is the expression of biologically undesirable, socially prohibited, or unacceptable instincts or deviation. Anorexia nervosa is an eating disorder that is primarily seen in adolescent girls and is usually associated with emotional stress or conflict, such as anxiety, irritation, anger, and fear. It is characterized by a prolonged refusal to eat, resulting in wasting, emotional disturbance concerning body image, and fear of becoming obese.
Bulimia is an insatiable desire for food that results in continuous eating, often followed by purging and depression. These are just a few of the most common psychological disorders, among others, that we will be studying later.
Hey y'all, ever heard of someone being scared to death of the most unexpected things? Today, I'm talking about some of the world's strangest phobias. Buckle up because this is gonna get wild. First up, acrophobia, that's the fear of heights. Even a stepladder can make some folks feel like they're on top of the Empire State Building. Imagine that. Then there's claustrophobia. You know that feeling when you're in a tight space and you start to panic? Elevators and packed crowds are a big no-no for people with this fear. Now let's talk about pyrophobia. That's the fear of fire. It's more than just being cautious around a campfire. Some folks can't even light a match without freaking out. Next on the list is agoraphobia. It's the fear of open or crowded spaces. For some people, stepping out of their home is like stepping into a lion's den. Zoophobia is next. That's the fear of animals. Yep, even those cute little puppies can send someone running for the hills. Ever heard of phobophobia? It's the fear of phobias themselves. Imagine being scared of being scared. Talk about a vicious cycle. And of course, the classic arachnophobia, the fear of spiders. Even the tiniest spider can make someone scream like they're in a horror movie. But wait, there's more. Did you know some people have nomophobia? That's the fear of being without a mobile phone. It's a modern-day nightmare for sure. Or how about trypophobia? The fear of small holes, honeycombs, or lotus seed pods can really freak some folks out. So the next time you think your fears are strange, remember there's a phobia for just about everything. Thanks for watching, and don't forget to like and subscribe for more crazy facts. See y'all next time.
It's quiz time again. Obsessive compulsive disorder is a phobia. B, a psychosis. C, a panic attack. D, an anxiety disorder. One volunteer at the time, please.
Acronyms and abbreviations. ADD stands for Attention Deficit Disorder. ADHD is Attention Deficit Hyperactivity Disorder. CNS, Central Nervous System. CSF, Cerebrospinal Fluid. CVA, Cerebrovascular Accident, or costovertebral angle. DSM stands for Diagnostic and Statistical Manual of Mental Disorders. OCD, Obsessive Compulsive Disorder. PNS, Peripheral Nervous System. TENS, Transcutaneous Electrical Nerve Stimulation. And TIA, Transient Ischemic Attack. Pharmacology for Chapter 13, Nervous System and Psychological Disorders. Drug class, effect and uses, anti-alcoholic agents, discourage use of alcohol. Example, acamprosate or Campril, disulfiram or Antabuse, anticonvulsant or antiepileptics, treat epilepsy and other seizure disorders. Some anticonvulsants may be used to treat nerve pain. Some benzodiazepines have anticonvulsant properties. Example, carbamazepine or Tegretol, divalproex or Depakote, ethosuximide or Zarontin, gabapentin or Neurontin, lamotrigine or Lamictal. Antidepressants treat depression and other mental or neuropathic disorders, including attention deficit disorder and fibromyalgia. Various subclasses with mechanisms of action that affect the balance of neurotransmitters in the brain. Example, amitriptyline, Elavil, atomoxetine, Strattera, bupropion, Wellbutrin, fluoxetine, Prozac, levomilnacipran, Fetzima, mirtazapine, Remeron, sertraline, Zoloft, tranilcypromine, Parnate, trazodone, Deserel, venlafaxine, Effexor, vortioxetine, Trintellix. Anti-migraine drugs treat migraine headaches. Example, ergotamine, Ergomar, sumatriptan, Imitrex, zolmitriptan, Zomig. Anti-Parkinsonian agents relieve symptoms of Parkinson's disease. Examples, amantadine, Simitrel, benztropine, Cogentin, levodopa and carbidopa, Sinemet, pramipexole, Mirapex, selegiline, Eldepril. Antipsychotics or neuroleptics manage the symptoms of psychoses such as hallucinations, delusions, or mania. Example, aripiprazole, Abilify, clozapine, Clozaril, haloperidol, Haldol, iloperidone, Fanapt, lurasidone, Latuda, olanzapine, Zyprexa, risperidone, Risperdal. Anxiolytics induce relaxation to relieve anxiety. Many drugs in this class may also be considered hypnotics, promote sleep, or sedatives, depress central nervous system. Some antidepressants and the beta blocker propranolol are also used to treat anxiety. Example, buspirone, Buspar, doxepin, Sinequan, hydroxyzine, Atarax, meprobamate, Equinil, barbiturates. Depress the central nervous system resulting in sedative, anesthetic, anticonvulsant, and anxiolytic properties. Barbiturates are not commonly used in humans due to the high risk of overdose. Examples, pentobarbital, Nembutal, phenobarbital, Luminal. Benzodiazepines depress the central nervous system, resulting in sedative hypnotic, amnesic, muscle relaxant, anticonvulsant, and anxiolytic properties. Example, alprazolam, Xanax, chlordiazepoxide, Librium, diazepam, Valium, lorazepam, Ativan, cholinesterase inhibitors, increase levels of acetylcholine to treat cognitive failures associated with dementia. Example, donepezil, Aricept, galanamine, Reminol, rivastigmine, Exelon. Hypnotics promote sleep. Non-benzodiazepine hypnotics. Many benzodiazepines are used for their sedative hypnotic properties in the treatment of insomnia, and some antidepressants are also used to treat insomnia associated with depression. Example, azopiclone, Lunesta, tasimelteon, Hetlios, zaleplon, Sonata, zolpidem, Ambien, orexin receptor antagonists. Example, suvorexant, Belsomra, mood stabilizers, balance neurotransmitters in the brain to prevent severe mood swings, mania and depression, and to treat bipolar disorder. Some anticonvulsants are used for their mood stabilizing properties. Example, lithium, Lithobid, stimulants or central nervous system, CNS, stimulants, increase synaptic activity in the brain to treat attention deficit disorder, narcolepsy, fatigue, or to suppress the appetite. Example, dextroamphetamine, Adderall, methylphenidate, Ritalin, modafinil, Provigil, phentermine, Adipex P. Do you have any questions, comments, or concerns that want to share with us?
Thank you so much for joining us in today's session. Your active participation is greatly appreciated. If you have any questions, concerns, or suggestions for enhancing our online sessions, please don't hesitate to reach out to us. We are dedicated to ensuring that your learning experience is as enriching and effective as possible, and we're more than happy to accommodate your specific needs. In the meantime, we encourage you to take some time to review the video, explore your ebook, and engage in the online practice exercises and tests. We eagerly anticipate reconnecting with you in our next online session. Wishing you a delightful remainder of the day.